Good day everyone, I am Katrina Alin A. Cordero from ESN 12 Section F, and today I will be performing my return demonstration about parental drug administration, particularly the intradermal injection. So this is to provide the medication that the client requires for allergy testing and TB screening. So for the preparation, the first thing that we're gonna do is to check for the MAR. So this is to make sure that the right medication is being given to the right client. Next is to carefully check the medication and compare it to the MAR to make sure that the right medication is being prepared and given to the client. Next is follow the 3 checks for administration. So first is to read the label on the medication when it is taken from the medication cart, and before withdrawing the medication, and lastly after withdrawing the medication. It is also important to organize our equipment. So as you can see here, I have already prepared all my equipment. So this is to conserve time and energy. So next thing to do is to perform hand hygiene. This is to deter the spread of pathogenic microorganism. And after doing that, what we're gonna do next is to prepare the medication vial for drug withdrawal. So what we're gonna do here is to mix the solution, and if necessary, by rotating the vial between the palms of the hands and not by shaking. Next is, as you can see, I have already removed the protective cap, and next thing to do is to clean the rubber cap in a circular motion. So this is to prevent the spread of pathogenic microorganism and also to protect our client. After doing that, we need to put it in the trash can. So next is for the withdrawal of the medication. So as you can see here, attaches a filter needle as agency practices dictates to draw or premix liquid medication from multi-dose vials. Also important to ensure that the needle is firmly attached to the syringe. So as you can see here, the needle is firmly attached to the syringe. Next is remove the cap from the syringe, then draw up into the syringe the amount of air of the equal volume of the medication to be withdrawn. Next is carefully attach the needle into the upright vial through the center of the rubber cap, maintaining the sterility of the needle. Then, inject the air to the vial, keeping the bevel of the needle above the surface of the medication. What we're going to do next is to withdraw the prescribed amount of medication by holding the vial down, then move the needle tip so that it is below the fluid level, then withdraw the medication. Next, explain to the client that the medication will produce a small wheal, or sometimes it is called a bleb. And the wheal is a small raised area like a blister, and the client will feel a slight prick as the needle will enter the skin. And information can facilitate acceptance and compliance with therapy. So, good morning, ma'am. I'm Katrina Alin A. Cordero, and I will be your student nurse for today. And may I see your wristband, please? Can you please state your full name and birthday?
Maple Benito Maple 2001.
Alright, thank you, ma'am. So today I will be performing intradermal injection, or also called as skin test. So I will be injecting a particular medication on your forearm, and this is to check if you are allergic to the medication or not. So is that alright? Next is provide patient privacy. So this is to establish rapport and to gain our patient's trust. So now I will be closing the windows and the door. Now, we will be going to select a site. So, it is important to remember that we should avoid the sites that are tender, inflamed, swollen, or those that have lesions. Next is to apply gloves. And this is to protect ourselves and, of course, the client from any spread of pathogenic microorganisms. Now we will be going to get a cotton ball and put alcohol on it, and this is to clean the skin at the site using a firm circular motion, starting from the center and starting from the center and widening the circle outward. After that, discard the cotton ball and then allow the area to dry thoroughly. So now I will be going to prepare the syringe for injection. So now I will be going to remove the cap of the syringe while waiting for the antiseptic to dry. And next is expels any air bubbles from the syringe. And small bubbles that adhere to the plunger are of no consequence. And a small amount of air will not harm any tissues. And grasp the syringe in your dominant hand close to the hub, holding it between your thumb and forefinger, and hold the needle almost parallel to the skin surface with the bevel of the needle up. And this is to the possibility of the medication entering the subcutaneous tissues increases with using angle greater than 15 degrees. Now I will be injecting the fluid. So with the non-dominant hand, pull the skin at the site until it is taut. And this is taut skin allows for easier entry of the needle and less discomfort to the client. Next is to insert the tip of the needle far enough to place the bevel through the epidermis into the dermis. Next is stabilize the syringe and needle and inject the medication carefully so that it produces a small wheal on the skin. And this verifies that the medication entered the dermis. Next is to withdraw the needle quickly, the same angle which it was inserted. And then cap it and then discard it. And then what we need to do is to put a bandage to the client. Next is, it is important to do not massage the area because massaging the area can disperse the medication into the tissue or out through the needle insertion site. Next is to remove and discard gloves and put it in the receptacle. And then perform hand hygiene. This is to protect our client and ourselves from any spread of pathogenic microorganisms. Next is with the help of the blue ball pen, circle the insection site with ink to observe for redness or induration. Next, it is also important to document all relevant information, record the testing material given, the time, dosage, route and site, and also the nursing assessment, because this will help us to ensure that the scenario already happened or has happened. Next is evaluate the condition of the site after 30 minutes depending on the test, and also measure the area for redness and induration in millimeters at the largest diameter and document the findings. And the rationale of this is that some medication used in testing may cause allergic reaction and epinephrine may need to be used. Lastly, document if the client has positive or negative test result and follow the agency protocol of labeling of allergies. And that will be all with my return demonstration about intradermal